So good morning, Mallory. How are you doing today?
Good.
Good. So we're going to talk about the mindfulness skill, mindfulness breathing today, to show to our employees during the month of January. So have you had any experience with mindfulness breathing?
Not really, no.
Okay.
I just breathe.
Just breathe. So you're halfway there. So mindfulness breathing is just being aware of you actually breathing and being aware of the breath and just that. So you're halfway there to that skill. So it's the first step into mindfulness breathing. So we can just practice it right now. So the benefits of mindfulness is calming and being aware of the breath, and breathing deeply actually builds strength in your lungs and is able to calm you and release some positive hormones in your body.
I need some of this.
Yeah. So mindfulness breathing can be done anywhere. You can do it when you're standing at primary care or when you're in office. It can be done between like 1 second and 1 hour. So it's pretty flexible in that time. It's pretty easy to do it in primary care and medical settings. So being able to take that 1 second for yourself is pretty easy to do. So practice. You can get in a comfortable position in your chair. You can do whatever feels comfortable to you. It's pretty flexible in that manner. You can close your eyes or keep them open. You don't have to actually change your breathing. So just your normal breathing and just being aware of your breathing. That's all there is to mindfulness, is just taking that second to yourself and being like, I'm here, my body's okay, I'm breathing. So just being able to take those couple of seconds for yourself and being like, I'm okay. So yeah. So how did that feel to do some mindfulness breathing?
Makes me sleepy.
Makes you sleepy. That's pretty normal. It's a pretty calming experience. So
Yeah, definitely.
Inducing sleep is definitely something that would happen. I usually use it to fall asleep at night sometimes when I'm like all keyed up and my brain's like going everywhere. So definitely a calming presence. So in terms of like other things you do to take care of yourself throughout your workday, if you use any, what gets in your way of being able to take care of yourself?
What gets in my way?
Mm-hmm.
I mean, we work in a health center where the patient is the center of everything we do. So it's very hard to put yourself in the center and take time for yourself when you're focused on a patient or patients and everything that they need and everything that goes into that. So it's very hard to stop at any point in your day other than maybe lunchtime and think, okay, let's calm ourselves down. It's a go, go, go type of work.
Right. So definitely putting yourself in front of putting yourself as a priority in front of others is definitely something that you don't do often.
No, definitely not.
Yeah. So how did it feel to take these few minutes to yourself?
Good. It's definitely something I think many of us could do a lot more of. Yeah.
And do you have any advice for your fellow colleagues, nurses, anybody who works in a medical setting to take time for themselves?
I guess, in this field, in the time that I've been in it, you can usually see the difference between people who do their job very well and very gracefully, and they succeed at their job and they aren't overcome by their job. It seems to be the people that have learned those boundaries of when to put themselves first and when to take time to do that self-care and really take care of themselves. I think that's something I struggle with. I haven't really perfected the art of self-care by any means, but a lot of my colleagues that I have a lot of respect for, they seem to do very well at it, and that's something I think we have to all keep practicing at.
Cool. Well, thank you for taking the few minutes of the day this morning to spend with me and to practice this technique for other people to see and hopefully practice. Cool. Thank you.
Good luck.